my name is Caitlin Polochack and I'm with Cook County Health. Thank you for joining us. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. That's 312-864-0200. My guest tonight is Dr. Thomas Ladd, Chairman of Hematology and Oncology at Cook County Health. Welcome to the show, Dr. Ladd.
Thank you for having me.
Thanks. So November is Lung Cancer Awareness Month. Can you start off by telling us a little bit about yourself and your background with the disease?
Well, I've been an oncologist for 40-some years, and I grew up at the Westside VA where at one time between 1975 and 85, lung cancer was the most common reason to be admitted to that hospital. Lung cancer is the most common cancer killer. It's a very aggressive disease. And if you look at the incidence curves of cancer, and lung cancer is sky high above every other one. But interestingly enough, it's had a downward trend lately because in 1964, the Surgeon General wrote that cigarettes was bad for your health. They put skull and crossbones on cigarette packs. And at that time, 70% of people smoked, 70% of men smoked. And it was kind of a rite of passage when you got out of high school. When you got out of grade school into high school, away from your parents, pack of Luckies a day. That was normal because it was looked upon as growing up. But the information about the danger of and the bad health issues of smoking had an impact. And so now, 40 years later, 20% of people, less than 20% of people smoke cigarettes. So it was a very positive public health effort, but it took about 30 years to see the result of that because it takes about 30 years of smoking to get lung cancer. You start smoking when you're a teenager, you get lung cancer when you're 55, 60. And so the incidence curve of death from lung cancer and lung cancer peaked at about the late 1990s, and since then it's been edging downward. So it's a very positive public health triumph, actually, in making people stop smoking. And when my son was in grade school, they said smoking was worse than taking heroin, which probably is. You know, so there's been a lot of educational propaganda anti-smoking to young people as they're growing up, which has been very successful, and it's made the incidence of lung cancer fall.
Right, so one of the prominent events is the Great American Smokeout, and the idea behind the Great American Smokeout is starting a journey through a smoke-free life. Can you touch on some of the benefits of quitting smoking?
Well, it's economic, which is good. So cigarettes used to cost a quarter a pack, now they cost some dollars. And so you spend lots and lots of your hard-earned money doing something that's bad for you. So that's probably the most tangible, immediate reward of stopping smoking is you won't waste your money on buying these things. Cigarette smoke is toxic to all parts of your body. It's toxic to you. People get lung cancer from smoking. 1 in 10 person who smokes gets lung cancer. How come the other 9 don't? That's an interesting question. But everybody gets coronary disease. Everybody gets emphysema. Everybody gets chronic obstructive lung disease because the toxins of cigarette smoke are more potent, globally potent. If you don't have the genetic wherewithal to get lung cancer, you have to be built in a certain way to get lung cancer, but cigarettes harm the rest of your body too. So it's not just lung cancer, it's lung disease, it's coronary disease, it's strokes, heart attacks, and those types of things.
Thanks. And how can you help a family member or a friend that is trying to quit smoking?
Well, quitting smoking is very, very hard. Smoking is an addiction. Your brain needs nicotine. And the cigarette companies a long time ago figured out, and this is what the FDA spent a lot of time getting control over cigarette smoke, which is done during the reign of Dr. Kessler, who was in charge of the FDA at the time. And the cigarette companies knew that the way to sell cigarettes, which is their product, was to get people addicted to nicotine. And so it was kind of backwards, but they knew that. And so they figured out ways to make the nicotine delivery in cigarettes more standardized. And their whole goal was to addict people to cigarettes because that's how they made their money. And so that was one of the ways in which the control over the cigarette business was achieved by the FDA against great opposition by the cigarette companies because, of course, they want to sell everybody cigarettes and make money.
Right. And can you tell us the difference between a cigarette and smokeless tobacco or an e-cigarette? Because I know a lot of people are smoking e-cigarettes right now with the premonition that they do not think it's as harmful as a regular cigarette. Is that true?
Well, yes and no. It's a nicotine delivery system. It addicts you to nicotine, and your brain needs nicotine once it's addicted. For example, a long time ago, there was some funding at the National Institutes of Drug Addiction where they incarcerated people who were smokers, and they weaned them off cigarettes and forcibly. They detoxified them immediately, and then they did complicated arithmetical sum adding for a month afterwards, like adding columns and numbers with 5 digits across and 20 digits down, see how accurate they'd be and whether they'd make mistakes. And people continued to make mistakes 30 days later after they were off cigarettes, and their funding ran out, so they really didn't know how long that lasted. But it's true, it's clear that your brain needs nicotine. And so one of the problems with cigarettes, tobacco, is that it comes along with a lot of other carcinogens that, along with the smoke, combustible smoke, that cause endothelial damage to the lining of your blood vessels and your lung lining, and also cause your cells to start growing when they shouldn't grow, which is what cancer is. Now, vapes don't have tobacco, but they still have vehicles to vaporize the nicotine, which are organic solvents, which are also toxins and carcinogens, although the dose is less than it is with cigarette. And smokeless tobacco vapes haven't been out for a long enough time to get epidemiological data about how toxic it is, what happens to people who smoke that all the time instead of cigarettes. The history of cigarettes is very long. Actually, in 1910, lung cancer didn't exist. There was a monograph written in 1910 about the disease of lung cancer, in which the person said, well, everybody with an abnormal chest x-ray has TB, but if you have a high level of suspicion, then you might see a case of lung cancer once in a while. That was 100 years ago. In a short time, that became the highest cancer killer. And the reason is they learned how to mass produce cigarettes. You didn't have to roll your own anymore. They would mass produce them and make them a lot easier to smoke, so you could smoke a lot more often, a lot more easily. But other things happened in that century too. Chemicals, all kinds of chemicals, and food preservatives and pesticides and all that kind of stuff. And all those things are toxic. The environment is toxic. And so it's not, in fact, people get lung cancer without smoking. That happens too. So we're a C in carcinogens, and if you smoke cigarettes, you're just adding a very potent one to the ones you're already exposed to. But vapes, they have solvents that have to vaporize the nicotine, and those are not innocuous either. They're carcinogens at a lower dose, and there's just not been enough experience to see the human price of doing that.
So can you get lung cancer from an e-cigarette, or is that not yet known?
Well, it's not yet known. I don't think. It takes 30 years to get lung cancer, we know, because you're smoking all your life and you get lung cancer when you're 55, 60. It's not an old person's disease either, by the way, although we see it in older people, but it tends to be a little less aggressive when it happens to older people, because why didn't they get it when they were 55, 60? Why did they wait till they were 90? So it's a little bit of a different disease. But it takes a long time to get it, and so vapes haven't been around long enough to see that. And so, but it is a vehicle for nicotine. You get addicted to nicotine. It has also been shown that kids who smoke vapes are more likely to start smoking cigarettes too. Because they, and the dose of nicotine you get with a vape isn't as high as with a cigarette. So if you need some more, then you'll gravitate to the more potent vehicle, which is cigarettes. So that's the danger that people talk about anyway, because there's not enough long-term observation of people who've been vaping all their life to see what happens to them.
So who gets lung cancer and why? And what about those people that you hear about that have never smoked a day in their life, have lived a healthy lifestyle, didn't have a family member or a spouse that was smoking, and all of a sudden they develop the disease?
Well, it happens, and it's not clear why. These are all genetically driven. Cancer is a genetically driven disease. You have to be built a certain way to be able to get it. And in the case of lung cancer, why don't smokers get it? Well, Some people can't detoxify the toxins as well as others, and so the carcinogens are more potent in people who are unable to detoxify them, and that's all genetically driven. And we're by just existing, we're having mutations occur in our bodies all the time, from sunlight, which is a radiation dose that we get from just being out in the sun, and all these pollutants that we're smoking and eating and drinking and exposed to all the time. So there are mutations that happen, and it's not clear why some people do, but there are probably a combination of mutations that come together to make you have cancer. Everybody's got a million of them. In a lung cancer, in a lung cancer tumor, there are 100 somatic mutations in the cancer, 100 of them. And so they're all around, and people the geneticists and molecular biologists trying to figure out what combination of what mutations exist that allow you to get cancer. And there are tumor bank trials going on with the National Cancer Institute now, where they're collecting tumor samples of all kinds and doing genomes on them and trying to figure out what combinations of genetic mutations are important and what aren't. It's very, very complicated, you can imagine.
So would you say lung cancer is hereditary? Or would it depend on if somebody was a
yes
smoker?
And no.
Or
I mean,
not?
if you look at population of people with lung cancer and take family histories of them, they're more likely to have someone in their family, not necessarily a first-degree relative, but somebody who's had lung cancer, than population of people who don't. So there's some genetic aspect to it. It's not like if your father had it, you're going to get it. It's not a Mendelian genetic pattern or something like that. But and these are all unknown. All these contributions of various genetic mutations and aspects of people. The school's still out. I mean, they're so complicated that people are trying to figure it out.
Oh, it looks like we have a caller. Hello, caller. Thank you for calling in today. How are you?
Hello?
Hi.
Hi, I'm doing just fine, thank you. I've been listening to the conversation, and I wanted to ask the doctor about a lung cancer vaccine I've been hearing about in Cuba. Since we've normalized relations, I've heard a lot more about the fact that one existed and that, a lot of people are traveling there to get it, and I just wanted to know if you thought that may be a credible course of action for people who do have a family history of cancer, specifically of lung cancer.
There is not a lung cancer vaccine. Cancer vaccines are combinations of viral vehicles that are hooked to antigens that are in cancers, and they try to introduce your immune system to the antigen that's in the cancer and use the viral vehicle as a replicator to rev up your immune system, hoping that it will detect the cancer. And that's kind of a theory, and people have been working on it for a long time, but it hasn't really come to pass, except in prostate cancer. There's one prostate cancer vaccine that uses a PSA as the antigen and uses a viral vector to do that. But it's very expensive, and it's not used very much because it costs so much, and there are other things that are better or more effective. But people have been talking about vaccines for a long time, and it would be nice. All the other major diseases have been conquered by vaccines, like polio and all those other bad diseases that used to exist. Even measles and mumps. Christ, when I was a kid, we all got them. Now kids all get vaccinated against them. At least people were smart enough to get vaccinated, which is another story altogether. But the lung cancer vaccines don't exist functionally. It would be nice if they did, but people are looking for them, but they don't exist.
Thank you so much for calling in. Okay, so speaking of vaccines, that's a form of preventative treatment. What are some other treatment options for people that do get diagnosed?
Well, lung cancer is a very sneaky disease. When you find out that you have it, most of the time the horse is out of the barn. It's already spread. Mm-hmm. The way cancer spreads, and this is not true just of lung cancer, but any cancer, is cancer cells aren't normal. They don't stick together like normal cells do. So they break off and float around through your system, and if they get sucked someplace that they like, then they grow there. And your body has a series of sieves, organs with very tiny blood vessels in them, like your liver and your lungs and your bones. And cancer cells are stiffer and bigger than normal cells, and they get stuck in these sieves. And if the conditions are good, then they grow. And that's how cancer spreads. Now, of 100 people with lung cancer, 15 will have an operation. The other 85, by the time they find out that they have it, you can take out both of their lungs and they'll still have cancer because it's spread elsewhere. It loves to do that. It's very sneaky. And of the 15 people who have operations, half are cured, the other half are not, because there's microscopic tumor spread already, which you can't see by any of the techniques that we have, and over time the metastatic tumor appears, and everybody said, oh, the tumor came back. It didn't come back. It was never gone. It was just too small to see when you got your diagnosis. So most of the time, lung cancer is a systemic disease that's spread throughout your body by the time that you find out about it. And how long does it take to do that? Well, not really clear. If you see somebody with lung cancer who's had a chest x-ray maybe within the last couple of years, and you know exactly where to look, then you can go back there and you can say, yeah, I think I can see where it started. So it might be a couple of years in starting, maybe less. It's hard to say. But by the time it's there, it's already spread, and that's the problem. But the best of situations is if you get lung cancer discovered by chance when you get an x-ray for some other reason, and then it's small enough and it hasn't spread anywhere, you do an operation, cut it out, throw it away, and you go on your life and everything's fine. That doesn't happen very often, unfortunately.
Is chemotherapy an option?
Well, what chemotherapy is it's poison that you get through your bloodstream that goes wherever the cancer cells went. And if the chemotherapy is effective in killing them, then it contacts them and kills them. The chemotherapy strategy is pretty crude. It's not very specific. What you're giving the person who has cancer some poison, and you're hoping that the poison is more poisonous for the cancer than it is for the person. And sometimes that's true, and sometimes that's not. But chemotherapy always has side effects, and it's very difficult. And anybody who's had it or knows anybody who's had it knows what I'm talking about. It's not fun at all. And our job, when we give it, is to realize that it's going to cause some trouble and try to figure out whether it's worth it. The trouble we're causing is worth it. Sometimes it is, sometimes it isn't.
Right.
Now lately, as people have learned more about the molecular biology of cancer and how cells grow and how they replicate themselves, then there become what are called targeted therapies or personalized medicine. There are certain mutations and enzymatic processes that are mutation driven that occur in cancer replication. And if a cancer has an abnormality in one of those systems and an inhibitor can be invented to counteract that, then it works. And there are some examples of that. If you have what they call driver mutations, where the certain mutation, and we have lots of them, remember, and only the important ones are the ones that are causing problems. And if you can identify a driver mutation that has an inhibitor, then the treatment really works. And so we look for those. They aren't very common. That's the problem. Most people don't have them. But the people who do, the outcome is much better. And so we're always looking for them because it's a much more sophisticated way of treating than just giving one-size-fits-all poison to everybody.
Right.
But that's how it is.
Can you touch upon clinical trials as
well, there's
an
one more thing that we have to say about as time goes on. And is now there's a new strategy for treating cancer called immunotherapy. And actually, I've been in this business a long time, and this is the first real breakthrough, if you want to say that has occurred. Because it's always been a question as to how come cancer exists? How come your body doesn't reject it? Because it's not you. So It's like getting your neighbor's kidney. You're going to reject that because it's not you. How come that doesn't happen with cancer? Well, it turns out that, and people have been trying to figure this out for 50 years, it turns out that cancers make substances that connect to the killer cells, killer lymphocyte cells in your body and paralyze them so they can't recognize the cancer. And they've figured out what some of these substances are and made antibodies against them. So the antibodies paralyze these substances so they don't attack the killer cells. That allows the killer cells to recognize the cancers and kill them. And that's what you see these, and actually lung cancer is the primary target for these things. And you see these advertisements on television. There's a drug called Keytruda or Opdivo, where they talk about people living longer with lung cancer. And it's really changed lung cancer to be a little more of a chronic illness than it used to be. So that's the big thing going on now in lung cancer. And it's relatively new. And some of the times you can get a very dramatic results from using these immunotherapy treatments. Clinical trials, you always get to a point where you don't know what to do. And there's a whole network of cancer clinical trials that are going on across the country that are controlled by the National Cancer Institute. These are different than drug company studies. Drug company studies are trying to create market share for their product. National Cancer Institute's clinical trial network trials are trying to find out the truth, or what's the best thing to do when you come to an impasse. And you always come to an impasse. You don't know what to do. And so they design trials where they compare treatment A and treatment B and see which one does the best. And these are networks of organizations that are all across the country. There are thousands and thousands of organizations that are contributing patients because they need lots of patients in a short time. And so these cooperative trials will contribute a large number of patients to a certain project. And they're very carefully orchestrated because everybody across the country has to do the same thing. You should follow these recipe books called protocols to make sure that everybody with the disease in question is being treated in exactly the same way, and they're exactly the same kind of patients, so there's a homogeneous group to study. But there's a lot of clinical trials going on, and at the county we have a big grant from the National Cancer Institute to do clinical trials through the National Clinical Trial Network. So we do that. That's one of the things that we do, because that's how progress is made.
Right. Can you talk a little bit more about the clinical trials that we're doing at county?
Well, we have a grant to do all of them. As I said, there's a network of clinical trials going across the country that are all funded by the National Cancer Institute. And they span all kinds of cancers, not just lung cancer, every kind of cancers. And we look at the menu that there is and see which trials we can participate in given the kind of patients that we see and the kind of diseases that we see and the logistics of doing the trials and stuff. So we do a whole bunch of them that span the whole cancer menu.
Great. Well, we are almost out of time. Do you have anything else that you would like to add or touch upon?
Well, we should talk about quitting.
Okay.
Quitting smoking is real hard. It's very hard to do because you're addicted to nicotine. And actually, of people who successfully quit, the average number of times they try is 5. So if you're smoking and you want to quit, then don't get discouraged if you fall off the wagon, because it happens, because it's an addiction. And there's a 800 number called 1-800-QUIT-NOW, which you can call up and it gives you, and also you can look up you can Google cigarette stopping smoking cessation. There's a whole bunch of web-based and also this telephone-based aids and ways of quitting smoking. And everybody's a little different. Some people go cold turkey, some people take nicotine substitutes, some people take Chantix, that's a neurotransmitter modulator, and Zyban, those are 2 drugs that have been used for quitting smoking, and so there's a bunch of them. None of them are great and none of them work for everybody, and it's real hard to do. So you have to be persistent and be motivated. A lot of times the most successful people have partners where they do it with, because it's good to have a buddy or someone who's going to help you, because you're going to need a lot of encouragement because it's very hard to do.
So what I'm hearing, it is very hard, and no method works the same for 2 people, but it can be done.
Right.
Right?
But the web has a lot of information about that. If you go on the internet and look, there's a lot of information about strategies to use and counseling services and web-based counseling and all this kind of stuff.
Right. Okay, well, thank you so much for joining us. This has been very informative. And thank you to everyone at home that's tuned in. See you soon.
All right, good.